you, Representative. Representative Sampson.
Thank you, Mr. Chair. And thank you for being here today, Kevin.
Pleasure.
I appreciate your willingness to come to the committee and give us an update. And I appreciate your comments. I do believe that Connecticut, as far as our competing states go, it probably is a step ahead as far as the rollout of the exchange and Obamacare. My question really is how we're going to gauge that success, whether we're going to gauge that success against the problems that other states are having, or based on a real definition of success, or even our own projections for when before the rollout actually occurred. I have a document back from May of last year that says that we projected reducing the 9%, or actually 9.6% uninsured population in Connecticut dramatically right during the first open enrollment period, which, if I understand correctly, ends on December 15th, just a few weeks from now, that we would have between 100 and 130,000 new enrollments during that time. And you just mentioned a moment ago that we were at 16,000 based on the new numbers. And I just wondered if you'd speak to that, why we are off so far from the 100 to 130,000 and only at 16,000 currently.
Yeah, so I think, I may have made an error when I made that quote, meaning that the open enrollment period actually ends March 31st. So the open enrollment period is actually 6 months. You're raising a good issue because, the people that we've talked to, particularly in Washington, that have implemented Medicare Part D, basically tell us that to expect the waves of an open enrollment to occur in two surges. The first is the period after Thanksgiving to that mid-December, and the second is the first 2 weeks in March, largely because people don't like to write checks 3 months in advance. I mean, certainly know I don't. And the second, quite frankly, is people kind of wait till the last minute to do stuff like this. I would love to say that buying health insurance is a sexy purchase, like a car or a smartphone, but a lot of people just don't wake up on a Saturday and say, you know what, I think I'm going to go buy some health insurance. So they tend to put off things like this.
So you're predicting that by March 31st we will meet that number of 100 to 130,000?
Our goal, Representative, by the end of March is to have 100,000 enrolled. And do I think that's an ambitious goal? You bet. Do I think that some of the activities that have occurred out of Washington over the past month impact that goal? Absolutely. Do I think there's confusion in the market about our website versus the government website versus, that type of functionality? Absolutely. We're working that through.
Understood.
But I would also tell you, Representative, that we are ahead of what we expected to be at this point. And you know what? That's our goal. That's what we've told to the board. If you put a gun to my head and tell me, am I absolutely sure we're going to make it? I would say I'm not absolutely sure. But I would tell you that I think we're going to do everything that we can to get there.
Okay. My perspective here, I really don't want to challenge you as far as your effectiveness, other than to say, up until just now, I was under the impression that our open enrollment period was December 15th. I don't know when that changed or how that changed.
So it must be an error on my part, because it's always been through March. That's in the law.
Okay.
Yeah. It's the first year, and then going forward, it's the last quarter.
Understood. Well, and you can understand my concern. I mean, the goal of the exchange and Obamacare in general is to keep people from being uninsured. And it seems to me we've had some cancellations and we've had some new signups. But I would venture to guess there are more people uninsured in Connecticut than there were before we started this. And that, to me, is a problem.
It's interesting. Now, it's interesting. The data that we have would suggest the opposite. Matter of fact, we just got some data in from census that would actually suggest the uninsured level that I was always expressing, which I thought was about 344,000, is actually closer to 300,000 now. So I think actually it might be going in the other direction.
Well, I'm just using the numbers that I've seen in the press, like anyone else. Over the recent couple of days, we've seen some press articles citing 27,000 policy cancellations.
Yeah.
And I've only had the numbers that you issued on November 14th that showed around 11,000 signups. But I understand it's now 16. But if you got 27,000 cancellations and 16,000 signups, to me that means you got 10,000 more people uninsured than you started with.
Well, I'm not an expert in cancellations. Our job, frankly, is to implement the law. I actually don't really know about the cancellations, and I'm sure there are other people that are much more experience.
I understand,
and
and I will
knowledgeable.
certainly be asking the insurance carriers when I get the opportunity
Yeah.
to talk to them about that subject.
Yeah. But one thing, Representative, if I could just add, is, in our culture, there's kind of a collective impatience. And we have instant gratification. If our computer isn't working, we reboot right away. If that doesn't work, we pull the cord. Implementation of something this complicated is a multi-year process. This is going to take 3 to 4 years to do. And the only thing that I would just caution the committee, as I do the press nationally, is that people need to have a little patience. They need to take a little deep breath about this, recognize that we're all going to have some hiccups in this, but we're going to make it work. It's going to get, areas are going to get fixed, but just let's not expect just too much too soon.
Okay. Again, in a different form, I might challenge you on some of that.
Oh, please do. You wouldn't be the first.
Yeah, let me just get on to my next question, really,
Sure.
which is about the demographics of the people that are signing up. And I know that I'm not the first person to express this concern, that it seems to me that young, healthy people are not the people that are signing up. And yet, for this to function going forward and to be basically a solvent operation that is not totally requires taxpayer dollars to subsidize the entire process, we need young, healthy people to sign up. And I'm just wondering if you'd speak to whether or not that's a concern and what the ramifications might be going forward unless we see a change in that trend.
Well, I'm actually pleased to report that the data is actually showing something that you might find a little bit more comforting, which is that 34% of our members are under 35. And that's one of the highest percentages in the country. So far, what we're seeing is actually very encouraging. If your broader question is, can that be sustained? What are the risks to that? Those are all really good questions, and that's the kind of crystal ball stuff that I, frankly, am not qualified enough to speak. But I would tell you that I think your premise about having a balanced risk pool is absolutely correct. I think that, but the other thing I would say, and I'm not trying to be difficult, is just that, this is going to take some years just to see how enrollment works. And, I go back to my days in Massachusetts a little bit, where we enrolled 123 the first month, 2,200 the second month. This just takes a little time. And I guess I would just ask the committee, like I would just tell the national press, that this is, we're not even in the first inning of a 9-inning game. And so far, I think the signs we see in our state are very encouraging. They're encouraging about the demographics that you spoke to. I think having 34% of our enrollees being under 35 is something that a lot of other states would like to have, and we're certainly hopeful that it continues.
I appreciate those comments, although I have to disagree that I don't think 34% under 35 is by any measure good. That means that two-thirds of the enrollees are over 35, and the vast majority of them are actually considerably older, at least from the numbers that I have from November.
That's interesting. That's fine. That's a very interesting perspective. I mean, frankly, if you look at the demographics of our state, I think having 34% under 35 is outstanding. But that's fine.
Let me just switch topics. I want to ask you about the storefronts, just briefly. Again, I came in with the impression that the open enrollment ends on December 15th, and now I understand it's through March.
Yep.
But is the plan for the storefronts that they're going to be open year-round?
Yes.
Okay, and what exactly will they be doing, after open enrollment ends?
Well, it's actually several things. First of all, open enrollment for small businesses does not have a defined period of time. So the small business program or the SHOP program, people can enroll throughout the year. Number two is that people that enroll for insurance, given the complexity that we all know health insurance can be, are frequently going to want a place to go to have questions answered and perhaps talk about a qualifying event, for example, if they get married or have a child, how does that impact their policy? We want to have some customer support service folks available to answer those kinds of questions. And to be quite frankly, third is we want to be a resource in the community for even people that don't buy on the exchange. So, for example, we're going to have information on nutrition, on wellness, on how to choose providers. So I honestly think, Representative, that the future of exchanges is not going to be limited just to the transactional component of an enrollment and renewal. I think more broadly what we're going to see, hopefully good exchanges, and I believe Connecticut can be one of those, will be a resource for all residents of the state, 3.5 million people in the state, because there's needs to provide education, there's needs to provide ways to actually understand insurance terms. And we think, and also with data. So we think more and more that that's a resource we can provide long term.
Okay. I mean, I would say that the private market has always offered this degree of expertise through our brokers, insurance companies, and so forth that have existed in our state. And it's obviously no secret that I'm somewhat opposed to the entire concept of Obamacare. Although I am somebody who supported the concept of the exchange all along and felt that it is a prudent idea to be able to get products and prices available to consumers in front of them in an easy way. Although there was some danger last year of moving towards a totally different model of active purchasing, which I was adamantly opposed to and I think would have been a complete misrepresentation of what we got to. And thankfully it did not happen, and I hope that there's no move in the future towards that. But I just want to say I appreciate your confidence moving forward, and I appreciate your desire to make everyone aware how hard you folks are working and what you're attempting to achieve. I would really like to have some element of confidence that we are actually going to see enrollment numbers that are close to the projections by March 31st now instead of February or December 15th rather, so that we actually do address the problem of uninsured folks in our state. Because, I mean, the figure you mentioned, 344,000, I mean, we barely made a dent in that in any respect. And I think that there is this concern that basically all the policies that are being purchased are going to be subsidized by taxpayers largely. You've got new people signing up for Medicaid, despite the fact that we've had the largest Medicaid expansion probably of any state before the rollout, which is probably to the benefit of your numbers showing the people purchasing in the qualified health plan marketplaces as opposed to Medicaid. But still, you just mentioned 7,000 new Medicaid enrollees. These are people that are basically a drain on the taxpayers. Should they exist? Yes, but it's something we've got to pay for. Do you have any further data of the was it 9,730 new enrollees in the qualified health plans?
That's correct.
Yeah, and out of those, how many are receiving some subsidy?
I think I'd mentioned about 50%.
50% are just so 50% of those plans plus all of the Medicaid plans are basically subsidized by the government at this point.
That's correct.
Right, and this is going to be at the expense of our Connecticut and national economy. Don't you see a danger in that?
Well, it's an interesting perspective you have because I actually see a bigger danger in having people continuously to be uninsured. I think that, we do all pay for the uninsured through uncompensated care in our premium.
Oh, I agree. We haven't made a dent in the uninsured.
Well, that's, again, interesting. I mean, it appears that the data is actually supporting something that's a little bit different than what you're saying, but that's okay. One thing I would just say to your point is that insurance exchanges are free market pro-competition means for people to get insurance coverage. And I think you can see this in part through the adoption of private insurance exchanges by many large firms, particularly the announcements by IBM, AOL, Time Warner, the Darden Group, Sears. I think we're beginning to witness more and more the 401k-ing of health insurance. So I think that I certainly appreciate the comments you're raising, but I do think that to look at this all through this sense that this is some type of government prism, maybe just a little bit narrower, but and also I guess the one thing I would ask you, sir, is just to say, I would just like you to take a little bit of a deep breath on just how we're doing. I think we're off to a good start. We've been up for 6 weeks. We seem to be off to a pretty good start in getting some folks enrolled. So let's just give it a little time.
Yeah, indeed. And I don't want to hold you responsible for the problems on the federal level. Although I would point out
that's helpful. Thank you.
And I would point out that they've had multiple years to be prepared for what happened as well. So as far as our website, our portal, it seems to be working okay. I understand you're doing your job as effectively as you possibly can, and you are faced with difficulties beyond your control. I completely understand that. I will stand by the fact that this is becoming nothing more than a huge welfare expansion. And the problem is we are going to be in a situation where there are people who are signing up at unbelievable levels of subsidies, and no one of the younger, healthy crowd to help offset that. And I think that's a huge danger going forward. I hope that you meet your projection of 100,000. I'm going to hopefully get the opportunity to congratulate you on that when it happens, but I'll be there to ask why if it doesn't happen as well. And just one final question before I let you go, and it's more of a technical question. You mentioned there are 5 plans in the 5 carriers rather, and as far as I know, there's only 3, and the data I have shows the numbers for the amount of enrollees for each.
I apologize for being confusing. What I said was there are 5 carriers that are active in the insurance market, of which we've got 3.
Understood. Okay. Thank you very much, and thank you, Mr. Chair.
Thank you, sir. Senator Kelly.